Thanks for finding us today on 5 City TV. This is Dale Johnson, and I'm talking today with Fire Chief Michael DESPAIN on Lincoln Fire and Rescue. Chief, thank you very much for coming in again.
Thank you. Thank you again.
We're going to cover a number of issues today. A paramedic recruitment class has begun. Another is in the works. Will those recruits be enough to adequately staff the needs of LFR? That's one question we'll get an answer to. And how will the Ground Emergency Medical Transport Supplemental Reimbursement Program benefit Lincoln? The chief is going to the legislature here very soon, so answers are coming up. But first, as we speak, Chief, the mayor is reading over a report from the Community Stakeholders Task Force, of which I was privileged to be a member. And he's reading it over, reading some of the findings, reading some of the priorities. And we will be doing a show in the future on an amended version of those findings and opinions. Am I correct so far?
Yeah. Remember what that committee looked at was they only saw half of the equation because they really didn't look at a lot of what's been done to this point. It's really just looking at the challenges moving forward. And so there's a time we have to kind of balance that with no one will read 5,000 items. You have to kind of summarize. So 5 or 6 sentences could be summarized into one, gets the same message across. And when you're looking at strategic planning, those are the pieces that we need to put together. So we're very close to being able to do that.
And that takes time, and we will do another show devoted to the findings once the mayor has had a chance,
I think in a couple of weeks,
to read that. So we'll talk about this report in detail in the future. So let's review, first of all, Chief, for the sake of review, what the members and the time spent and the effort and your thinking behind even conceiving a Community Stakeholders Task Force.
Well, a lot of agencies in the past either did no strategic planning, or if they did it, it was all done in-house. It was firefighters kind of building their own kingdom, so to speak. And we forgot to reach out and make sure that the people paying their taxes are getting the services that they want. And sometimes the service could be higher than we're providing. That's the desired service. Sometimes it's lower. They have more tolerance for risk. They don't want taxes. They don't, property tax. And Lincoln is in that realm where we have to balance the needs of the fire department with all the other needs that the city has, and then the willingness of the community to either take on the risk or cover the cost of the additional service. And so it's a tough road. It's a tough road to kind of travel down because you got to get a lot of people with diverse backgrounds to kind of come to commonality in terms of what you want something different than me. We have to kind of march them down the same direction to find some commonality so we can say that's a milestone that we want to reach. So Lincoln has done strategic planning before. I think it's probably one of the agencies that's been doing it longer than most because they were one of the first agencies to be accredited through an accredited agency that specializes in fire service agencies. So that's the benefit. It's just now's the day where we have a chance to relook at that process and put the citizen input kind of on the front end before we start building the rest of the blocks, just to make sure we're going down the right path.
So as we speak, the mayor is reviewing that report. Also, as we speak, a group of 6 trainees are learning what it takes to perform at the high paramedic level of LFR. 6, right? 6 is okay, but you would have liked at least twice that many.
Yeah, so right now what we hired is the 6 people that we have in the academy now. They're already paramedics. We stole them from some other industry somewhere. Some of them were firefighters before, some of them were not in firefighting. So they're already paramedics, they're already practicing. We're just bringing them over to say, here's how Lincoln Fire does things a little different. High performance CPR, the cardiac survival rate's important to us. And so we have the methods to do that. So we're fine-tuning some of their medic skills, but then we have to, basically get them up to speed on the firefighting skills, and some of them have no experience in that or limited. And so the combination of the two will take us, literally till late spring before they're done. But so far they're doing well. And 6 is, yes, we would have liked more. We'll take 6, but we would have liked more. Our problem is, and we've done quite a bit of outreach. The last show was on recruitment. We've done some stuff through social media trying to get attention. And really what we want to communicate is that it's not that we don't have enough. We need more firefighters on the books. This is just to get caught up to allocated staffing. I've already got the authorization to have this many people on the department, but we lose them faster than we can recruit them and train them. And some of them through retirement. Some of them are medically injured and they retire out. Whether they don't want to, but they must. Some of them just find different jobs and they move on. And so we have to try and replace that at a rate faster than we lose it, and that's where we're missing. So anything less than 6 or 7 a year of hiring, we are considerably negative. But our goal would be, ideally we'd be about 12 to 15 would be a good number to put through. And so the next process we're doing right now, we've already started another recruitment. We're trying to reach those numbers.
How do you recruit differently for one that's on the heels of a program that's already going on? Do you change your style a little bit to try to get more than 6?
Yeah, it's not an exact science. I kind of say it's more art than science. But one thing that we did was, because it's so close to the last recruitment, is sometimes you're kind of pulling in the same candidates you saw before. So we tried to make sure we cast the net a little wider. We actually had people go to different communities kind of surrounding us, as far south as Kansas City and maybe obviously north of Omaha, to try and grab communities where they have paramedic classes and courses going on, and try and recruit those agencies. Social media, we did a lot of different things trying to reach that group so that maybe it was wider. And then the other thing we did was we really targeted what we would call lateral transfers. So we wanted to see, are there firefighter paramedics in other agencies that want to come to Lincoln? Now, that's a little experimental. I don't think we've done that in Lincoln before. I've seen it done in some different agencies. It doesn't work exactly the way you think it would work. The hope is that we find a few more people that we can hire quickly, train them a little faster, pay them a little extra money to get them to come over, but their training time shorter. So it's a good business decision for the taxpayer. We get them out in the field sooner. But what we found is in the past is that sometimes a lot of people are interested in it. They'll apply for it. They'll go through the testing process up to you're a week away from the academy, and then they'll get cold feet. And part of that is they're already established. They kind of have their friends. They don't have to go through probationary process again to go through an academy, maybe a challenge for them, and that cold feet kind of catches up. And see, they have nothing to lose because they're in a job. They didn't lose anything. When we hire off the streets, they're desperate for a job. They're excited about the job. And so it's an experiment. We're kind of seeing how it works. It doesn't really hurt us. It's just a matter of whether we hire a group of people specifically as lateral transfers and rush them through so we get a class out sooner to hit the streets, or we do a more traditional hire. Either way, we're still doing an academy basically right after this one.
Is this struggle of recruitment common across the country?
I don't know if it's common in every state, but I know that there's quite a few states that do struggle with it. Nebraska's one. A lot of people, if you are a paramedic, you can go to a lot of different states and a lot of different agencies and make more money. At the same time, Lincoln's recruiting. Last week I had a meeting with a number of chiefs from throughout Nebraska, and they're all recruiting at the same time. And sometimes they're recruiting because it is a few people that I hired and they're recruiting, but we're competing for that same market. And so they all kind of express the same fear, is that they're trying to stay on top of their numbers and not get far behind, but it is tough to recruit. So, but if I look at the trade magazines or the websites that advertise that, it's very common to see agencies in what we would call constant recruitment. They never close the door. They're always recruiting firefighter medics and police officers, and they don't stop. So as soon as they get 10 or 12 or 15 names, they shove them through the process and try and get them hired, and they wait till they get another batch, and they just don't close it.
You don't have a need, though, for firefighters, do you,
well,
at the moment?
Well, what we need is medics. If
Right.
they're already a firefighter, then we'll take them, and that's a good advantage for us because they're already trained. And we can pay them a little higher money because they don't have to stay in the academy as long. They can hit the street and provide service. But no, we are only recruiting for medics right now because that is the classification that is harder to fill, and the one that we need to keep both the ALS service we provide on that first engine that shows up, and then the ambulance that follows behind. So,
But for someone listening who wants to be a firefighter
Right.
in Lincoln from scratch,
right. Well, so
is
number
that
one
school-
is
is that class open?
Well, go to medic school, and there's plenty of them. If you don't know where to go, let us know, and we got people that will line you out on different places you can go. But go to medic school, go get your paramedic training ready to go, and then you come see us. And if worst case scenario is we'll put you on the list and contact you when the next recruitment is. You never know. We might be in constant recruitment, and that's an option that we may be looking at down the road.
You go into the legislature here very soon in front of a legislative committee on LB 578.
Yep.
This is a bill dealing with ground emergency medical transport. Explain that.
Well, so one of the problems that we have, and this is throughout the United States, but in particular in Nebraska, is when we provide service, EMS service, and very specifically in Lincoln, there is no taxpayer money or little taxpayer money that subsidizes that. In Lincoln, there's no taxpayer money that subsidizes that. So if you see an ambulance and firefighter medics running around an ambulance, that's not taxpayer money. That's fee-based. We run it like a business. However, over time, the problem is of some of the people that we transport, the federal government says we're going to pay their bill for them. And you can't go after them, and you can't charge anything extra. We're going to pay it. But we're going to give you what we think we want to give you, not what it actually costs you to provide the service. So the actual cost to provide the service may be about $500 for that ambulance ride. The federal government says we're giving you $178. Well, years ago that was much more narrow. You know, the cost may be $200 and they paid $100, but as it's gone up to $500 over the last decade, they're coming up much slower. Not even cost of living. In fact, last year they actually did it less. They took some money back, so that gap gets wider. So to make ends meet, we have to charge people that have insurance and private pay individuals that are paying cash out of their pocket. We have to charge them $1,000 or more to provide that same level of service. And even though that sounds unfair and we don't like it, that is how the rest of the United States work. That's how the hospitals work. That's how your doctor's office works. They're all struggling with that. The problem is in a lot of other industries, you can say, I'm not taking new patients, or, you know, I'm not doing business here anymore because I'm not making a profit. I'm going to go somewhere else and close shop and go try somewhere else if the market can't support you. Here we can't do that. We have to take the 911 call. We don't even ask them if they have insurance. We treat the patient, we get them, and we solve everything on the back end. So that unfairness is getting worse over time. There's a provision within the rules that say the federal government will pay you a little extra money. It doesn't pay their fair share, but it'll pay you a little bit more if you'll go through this process of accounting, careful accounting of your costs. The only way we can do that is if the state adopts it, and we have to, administer that through Department of Health and Human Services. So 11 states have this in place now, including a lot of them that surround us. It's just we're trying to get Nebraska up to speed and kind of follow with where the rest of the United States is going, and get it positioned so the EMS providers within the state can stop that bleeding, if you will, from a business sense, so they can stay a little more solvent. For Lincoln, if we were to get that, what it would mean is the top end payers would actually drop a little bit. So the bottom end payers are paying a little more. The top end's coming down. Now, that doesn't impact the patients at all. It's really an agreement between the government and us, but we need to pass the legislation to legally be able to participate in this program.
So basically, Nebraska just has to go and ask. A law has to be passed to enable Nebraska to ask.
Enable us to ask, and really what we negotiate is a state plan amendment with the Centers for Medicare and Medicaid. So CMS, we negotiate that, and like I said, 11 states have it where they'll say, okay, we'll pay you a little extra because you've done your homework. And part of the reason why the federal government, I don't think it's out of their goodwill that they want to do this, but they recognize a little bit of the problem. Really where I think some of the incentive came from is they recognize the advantages of what we call definitive care. So care on the first few minutes of patient contact can make as much different or more than when they get to the hospital. A good example would be a person has a heart attack and we treat them in the field. If we do everything right, a high percentage of those patients will go to the hospital. The hospital will do what they need to do. They help them survive, obviously, but they spend a day or two in the hospital. Their chest hurts. They got to go in for some procedures, maybe some follow-up, but they're back to work. They're with their family.
They're paying taxes.
They're paying taxes. Now, the cost to the federal government, if they're under a program like Medicaid would be about 40 grand. So the government paid out 40 grand for that patient. Same patient now, we didn't get there in time. We only had 5 ambulances instead of 6 to service the city because we couldn't afford it and we were slower. And now we get the patient and we save the heart. Their heartbeat is beating, but their brain is now not survivable. And so they become in a vegetative state. Now they're in long-term skilled nursing for years and years and years at hundreds of thousands of dollars a year. So that's just an example of where definitive care on the front end, $1 on the front end may save 2 or 3 or 10 on the back end if you do it right.
We'll watch that. That's Bill LB 578.
Yeah.
All right. In closing, Chief, I wanted to ask you about drones.
Yeah.
As part of the stakeholders' hands-on,
Right.
there was a drone that videoed some of our exercises, and it was a delightful video
Right.
to watch. It's an amazing thing to watch. But in New York City, a drone for the first time helped put out a fire. They maneuvered a drone, navigated over the apartment building.
Mm-hmm.
The drone camera was able to detect the collapsing ceiling before it caved in, giving the supervisors time to pull the firefighters out.
Right.
How close are we to that day here in Lincoln?
Well, we've already started some investigation into that. Both the police department, the health department, a lot of the different agencies were asked at a meeting by the mayor about would this make sense? What do you think about this? And so everybody's kind of weighing in of the good and the bad, of the advantages. Most people see the advantages, but there are some hoops we have to jump through, in particular because we're a government entity that creates a little more regulation for us than, say, the hobbyist personal use. But I think you'll see that fairly soon. Ideally, we would want grant money or someone else to help pay for that so we can get it. But the one that you saw was just one of our firefighters that was a hobby drone that he just provided for the training event, just as a nice thing to do for the group. But I have seen them in use. Many years ago, the military grade ones, we used them on large scale incident managements in large fires and incidents on the West Coast. And so I've seen those in action. More recently, maybe within the last 3 or 4 years, an agency I work for, we had used them in particular on a large scale apartment complex where, same thing, there was some collapse problems, and we were too worried about putting people on second or third floor depending on the collapse. And so the fire was basically knocked down enough that we had a little bit of time. We actually used a drone to fly it through the hole in the roof that the fire had created and flew it through the apartments so we could see where the floor had collapsed or where it looked like there was some sagging, so we knew how far we could get in safely. And so the use of those have been around for quite a while. How soon we have one here in Lincoln, still another show.
Okay.
Yeah.
Speaking of another show, we want to let you know that coming up, we will be talking on the next show about the Stakeholders Task Force report. Right now it's in the mayor's hands. He's reading it. There will be some tweaking, and that'll be coming up. So check the city's website, lincoln.ne.gov, and you will see programming that will guide you toward our latest show.
Yeah, absolutely.
Chief, thank you very much for coming in.
Thank you.
Fire Chief Michael DESPAIN, my guest today on Lincoln Fire and Rescue. I'm Dale Johnson.